Healthcare for children in the Mid-South will get a boost early next year when a new pediatric emergency department opens. The new facility is part of an ongoing effort to provide medical care from birth throughout childhood in a single location. The multi-million-dollar pediatric ER is set to open on the campus of Baptist-Memphis early next year. Rod Starns has a preview in today's cover story.
The latest addition to the Baptist Women's Hospital is nearing completion. Construction crews have been hard at work for more than a year on a 3-story addition to the hospital. The original hospital opened in 2001 with the expectation that it would expand its services beyond its original mission of caring for women, delivering their babies, and offering some treatment for children. The hospital's administrator says emergency care for children is just weeks away.
Starting out January 28th, it'll be the first floor will open, and that's the pediatric emergency room and the pediatric diagnostic area called Petey's Perch. And then for future growth, hopefully in the near future, we would actually move our inpatient unit from within the women's hospital over, and I'm sure at some point we're going to need pediatric intensive care.
They broke ground for the 17,000 square foot emergency department in the summer of 2013. When it opens, the emergency area and 3 additional floors will be named the Spence and Becky Wilson Baptist Children's Hospital. A major donation from the Memphis couple will help Baptist expand both in- and outpatient services offered in the new pediatric hospital, which is next to the existing hospital for women. All these sights and sounds of a construction site are present as work continues, and special efforts are made to keep the work from disturbing medical care in the rest of the hospital.
We also take the patient's satisfaction into consideration, making sure that we're moving patients if it's going to be a noisy construction day. We relocate patients that might be near that construction. We make sure they're aware of what's going on. And even the kids on the 3rd floor can watch the construction, and that's exciting.
It's difficult to see, but outlines on the floor of the unfinished area show signs of the plan to turn the clinical experience into something that could be more pleasant for sick kids to be around. In addition to emergency care, the hospital will include a dozen inpatient beds, as well as outpatient surgery services and a pediatric eye center.
Well, from the outside, it looks like our hospital that we've had. But go inside, and you're going to see a whole nature theme. You're going to see lots of trees and nature and animals, and it's going to be very, very child receptive.
There are currently 5 pediatric emergency beds in Baptist Hospital, Memphis. Those 5 will move to the new facility with an additional 5 beds when it opens in January. And the new building is flexible enough for another 5, for a total of 15 if there's a need.
I think it will increase the patient flow that we have now. Giving the pediatric emergency department and future children's hospital an identity as caring for children really speaks to parents and caregivers that we have a facility specifically designated for children and designed for children to take care of their specific needs with child life specialists. It really highlights that kids are different than taking care of an adult. And so we do anticipate an increase in traffic and anticipate that in our plans for the future.
Baptist executives have worked with experts from Vanderbilt University to determine staffing needs and to anticipate how many people will use the emergency department when it opens. They're expecting more than 7,000 visits in the first year. For Smart Medicine, I'm Rod Starns.